Every year, more than 200,000 women and 2,300 men are diagnosed with breast cancer in the United States, according to the Centers for Disease Control and Prevention. The best protection against this disease is early detection. Hello everyone, I'm Susie Lowry Hall and I'm Enloe's Community Outreach Coordinator. I'm here with breast surgeons Dr. Karen Ching-Tismal and Dr. Soumya Pai from Enloe's Comprehensive Breast Care to talk about this subject in honor of Breast Cancer Awareness Month. But before we get started, please remember that the information that we're about to share is not intended to be medical advice. If you have specific questions about your health or the health of your loved ones, please talk to your provider. And as always, feel free to post your comments and questions in the comments field, and we'll do our best to answer as many as possible during the broadcast. And with that, we'll go ahead and get started. Thank you, Dr. Ching-Tismal and Dr. Pai, for being here today. So Dr. Ching-Tismal, I'm going to go ahead and start with you. My first question is, we mentioned this earlier, but can you tell us a little bit more about what breast cancer is and a little bit how common it is, some of the information?
Hi, Susie. Thank you for having us, and good day to everyone. So that's a good, very good question. Breast cancer cells are abnormal cells that develop in the breast of men and women, and these abnormal cells tend to want to invade, destroy the breast as an organ, and do have a tendency to want to spread to other parts of the body. That's what makes them cancer or malignant. Unfortunately, breast cancer is a pretty common cancer. So in a woman's lifetime, around 1 in 8 women could develop breast cancer. Some women may have higher risk based on certain risk factors. And the older women get, the higher the risk becomes. There's also a risk in men of breast cancer, not very common, so less than 1% of cancer in men are breast cancers. But we also want to make sure to highlight that this kind of cancer can also happen in men.
When you talk about risk factors, what increases somebody's risk? Who's at risk of this cancer?
So like I said, gender in itself, unfortunately, already confers a risk. So being born female will put you at risk for breast cancer. There are certain risk factors that can be modified and some that cannot. So I'll start with the ones that we can modify. One of them, and very important, is lifestyle. So very good diet, exercise at least 2 to 2.5 hours every week is the recommendation of the American Cancer Society of moderate exercise. By healthy diet, we mean more fruits, vegetables, chicken, and fish, and less of the red meat, processed and salty meats. Alcohol in moderation, or totally avoiding alcohol, avoiding smoking, avoiding estrogen and progesterone hormone replacements after menopause, having children, although that is a personal choice right now, breastfeeding your children, these are all modifiable risk factors. The non-modifiable risk factors include the gender you're born with, age, so advancing age increases risk for breast cancer. If you've had previous other types of cancers in other parts of the body, especially the ones that entail radiation. Also, we cannot choose the family that we are born with. So if we do have a lot of family history, mother's side or father's side of breast, ovarian, prostate, colon cancer, melanoma, skin cancers, then those non-modifiable risk factors can also increase someone's risk for breast cancer.
Wow, that is incredible. Thank you so much for that information. Well, you already talked about what we can do to reduce our risk, and a lot of lifestyle changes, it sounds like, so thank you for that. What are some early signs of breast cancer? What can we be on the lookout for?
Thanks, Susie, for that question, because it's quite important. We don't always pay attention to our own bodies. So I think the first sign is to kind of pay attention to your own body. Look at both your right and your left breast. Look at the nipples. Feel the area. What you're looking for is you're looking for any skin changes where either the skin is getting red, looks a little different, maybe like an orange peel, or maybe it's getting pulled or sucked in, which we call tethering. Or you're looking for sort of scaliness around your nipples. You may also have your nipple pulled in towards your chest wall, that is called nipple inversion. Looking for nipple discharge, especially if it's bloody or clear. Those are signs that you definitely need to go and get it checked out by your family doctor. Also, feel your breasts and under your armpit. If you feel any lumps or bumps there, which you shouldn't. So it's good practice to do self-exams, be aware of that. And if you feel anything like a lump or a bump, go get it checked out.
That's great. Thank you so much. And again, it sounds like doing regular self-examinations would be a great way to protect ourselves. So when should women get a mammogram and how often should they get them?
That's another interesting question. This has been the subject of controversy both in the public health field as well as among doctors' organizations. There are several different recommendations out. What everyone agrees is that screening mammograms are helpful. It's just the ages at which they recommend that these be done that differ. The US task force, which most of you might have heard of on the television, in 2016 came up with the notion that people above the age of 50 and until the age of 74 need to get mammograms done once in every 2 years. Younger than that, they said you talk to your doctor. Older than that, they did not see any great benefit. However, the American Cancer Society and most surgical organizations like the American Society of Breast Surgeons recommends that patients between the age of 40 to 45 talk to their doctors and decide whether they would want to go ahead with mammograms annually. But from the age of 45 to 54, that they get it done regularly every year. Between 55 and till however long you are healthy, they recommend it at least every 2 years. There is no upper limit to the time that you can get your mammograms at. As long as you are healthy and as long as you think that you will live for at least another 10 years, you should have a mammogram. This obviously is for people who have average risk. That is, they don't have any high risk features. Like they don't have anybody who has cancers in their family, they don't have a genetic predisposition to cancer, they haven't had a cancer themselves in the past, or had radiation to the upper body and chest wall in the past. In those cases, patients who we consider high risk, it's recommended that you talk to your doctor, and usually you will start something like mammograms as well as MRIs every year around the age of 30. But again, that is something very specialized and something that you should discuss with your doctor.
That's great. Thank you so much, Dr. Pai. So can you talk a little bit about being diagnosed with breast cancer?
Being diagnosed with the breast cancer is a sort of a scary moment for all of us. Usually it's something that is diagnosed by either the patient or their doctor when they examine them. Many times it's caught by screening mammograms. As surgeons, we like the ones that are caught by screening mammograms because they are caught early. But usually what happens is if any of the signs that I spoke about earlier, like you have skin changes, lumps, or nipple discharge, then a patient or the person affected goes to the doctor, gets it checked out. The doctor usually orders imaging. This can include things like mammograms, ultrasounds, and MRIs. That will confirm that there is indeed something suspicious going on. After that, the patient usually is taken over to get a biopsy. And the biopsy is usually a core needle biopsy. This is basically where you go to your radiologist's office. They numb up the area and they just put in a hollow needle, pull out some tissue, and send that tissue to the lab for processing. It's a simple procedure. It can be done pretty quickly, and that will help the pathologist look at the tissue under the microscope to tell us, yes, this is cancer or not, and what kind of cancer and what kind of receptors, and that helps us guide the treatment further.
And that is my next question. Thank you for that. That was really helpful. Again, as we, as you mentioned, Dr. Ching-Tismal mentioned how, again, if you're a woman and you have as we age, knowing kind of what things to watch out for, and then also our treatment options is so helpful. So I guess that is my question. So what treatment options are available for our breast cancer patients?
So we live in exciting times where breast cancer has a lot of research going on. There are several modalities of treatment. A patient may have one or a combination of multiple treatments. Dr. Ching and I are surgeons, so you would see somebody like us for the surgical option, or you would see a medical oncologist for something called hormone therapy, where we give you medicines to block hormones. There is obviously the possibility of chemotherapy, where we give you medicines to help kill the drugs. There's something called targeted therapy, which is a kind of a specialized treatment which we give for cancers which have certain receptors like the HER2 receptor present. And there is radiation therapy as well. What usually happens when a patient is diagnosed with cancer, they are referred by their physicians to a breast surgeon or a breast center like we have here with Enloe Comprehensive Breast Care. And then we look and evaluate the patient. We discuss the patient in our weekly conferences where we have a multidisciplinary team. This includes, apart from the medical oncologist, the radiation oncologist and the surgeon, it includes the pathologist and the radiologist. We go over every patient who is diagnosed with cancer, talk about what we found, what would be the best line of treatment. Is this someone who would get surgery first or somebody who would get medicines like chemotherapy first? And if this is somebody who needs radiation after that. So once we do all that, then we sit and talk with the patient and their families and go over what we would recommend and give them the options. So the patient has the choice to choose what would be best for them and their family.
Susie, I'd like to add to Dr. Pai's comment. I agree completely with everything she said. All of these treatment options sometimes are necessary, but sometimes they're not. And that's why Dr. Pai a while ago emphasized the communication with the medical provider and the patient or the individual regarding abnormal findings in their breasts. When is a screening mammogram supposed to be done? How often? Is because the early detection may be able to negate some of these treatments like chemotherapy or big mastectomy surgery if we are able to find the breast cancer early enough. So less need for certain treatments, less possibility of complications, better outcomes, and less likely that this cancer will come back in the future. And I completely agree with Dr. Pai's statement about our multidisciplinary approach here at Enloe. So even though maybe you're just seeing one of us first as an initial consult, we always have a multidisciplinary discussion with our colleagues who treat breast and other cancers. So we are sure that we have one consensus recommendation. And this multidisciplinary, multi-specialty way of treating patients individually gives the best outcome overall for breast and other cancers.
Wow, both of you, that is pretty amazing work. So thank you for sharing all of that. And this actually brings me to my next question, and that is cancer diagnosis, I'm sure, is very hard for people emotionally and physically. So can you share a little bit about the resources Enloe has to support a patient through this journey?
That is a very precise statement that you made. So it is not just a physical diagnosis, it is an emotional, psychological, social, family is involved kind of a diagnosis. And we here at Enloe Comprehensive Breast Care, our staff here and the entire staff at the Enloe Regional Cancer Center, we offer services outside of the treatments that Dr. Pai and I have special training for and the other cancer doctors have. So at the onset, our patients meet our patient nurse navigator. So that patient navigator will be the patient's go-to person from start to finishing treatment. So whether that patient completes her entire treatment with Enloe or has to go back to Reading or Yuba City or wherever they are locally, our patient navigator is the one that guides them from start to finish and makes sure that the patient does go through all of their multidisciplinary care. We have social work services at the cancer center. We have younger patients who may have children. There's child care issues, transportation issues. We have a good financial department that understands out-of-pocket expenses sometimes can be too high for our patients. We have support funding locally and outside Chico for that. We have our social worker that also helps us identify patients who may need to be referred to our psychiatrist. So we have a psychiatrist and counselors that are specialized in helping patients with cancer in their journey, coping with the diagnosis, accepting diagnosis, and going through treatments. We understand that's very important as a holistic total treatment of our patients. We also have ancillary services. We have our lymphedema clinic. So there's a potential for side effect from treatments that we give patients, and the lymphedema clinic is one of these, where the therapists help us prevent the possibility of arm swelling from breast cancer treatment. We have our genetic counselors, so in patients who may be at risk for breast cancer because of family history, like what Dr. Pai identified, our genetic people or nurse practitioners that have special genetic training can help identify if a person needs genetic testing and if certain treatment options need to be modified depending on that genetic testing. So we are fortunate that Enloe as an institution has been very supportive of us in making sure that we have all of these ancillary services available for our patients.
Wow. Thank you so much, both of you. That was such great information. I know I learned a lot, and I am sure that the people who are watching have also learned a great deal. So that's all the questions I have for today. Do you guys have anything else you'd like to say before we sign off for today's event?
I would like to echo what you said at the beginning, Susie, about early detection for breast cancer is the best protection. So we can, like both Dr. Pai and I mentioned, be able to treat you as minimally invasive as we can and still have the best outcomes, less complications. So self-breast awareness, breast exams, discussing mammograms with your providers, I think those are the best takeaway from this talk that we have, Susie. Thank you.
Thanks again for being here, Dr. Ching-Tismal and Dr. Pai, and thank you all for watching. Please join me for our next Facebook discussion in November when we talk about celebrating the holidays season during the current pandemic. In the meantime, remember to get your mammogram. And again, early detection is the best protection against breast cancer. Take care.